Namaste, this is your Dr. Vinay, surgical gastroenterologist, trying to tell you a few precautions about in what is happening in the society today. Number one, Namaste. No handshaking, please. In fact, I had been advocating this for quite some time because you have no idea what the other person would have done before coming to you and shaking hands. Has he scratched his hair? Does he have dandruff? Has he put his finger into his nose? So it's not just coronavirus. Generally, we have a wonderful way of greeting, either by Namaste or Adab. Why should we put ourselves at risk with leaving something traditional and going for something untraditional? These days, especially if you're shaking hands, you're directly getting infection either from the other person, or if you have, you're transmitting to the other person. And then if you're getting it, then your whole family becomes at risk. That's number one. Secondly, don't cough into your hand, because that becomes a risk area. Don't even cough into a handkerchief or a tissue paper. One is, handkerchief is not absolutely foolproof. It has pores, and virus is microorganism. It can easily travel through the pores onto your hand. And then the handkerchief is not a disposable thing. You will fold it and keep it in your pocket and make it an eternal infection transferring agent. When you take a tissue paper and cough into it, can we guarantee that we are only coughing into the tissue paper and the surrounding areas, it's not spreading? No, you can't do it. I mean, when you sneeze violently, the tissue paper can tear a little bit and the virus can go anywhere, or it can also spread into other hand. So it's always better that cough or sneeze above into your sleeve, above your elbow, which is the safest. Maintain at least more than 2 to 3 feet distance. A cough, droplets coming from a cough or a sneeze are known to travel up till about 3 to 4 feet. So at least have a safe distance so that the other person coughs or sneezes, or when you cough or sneeze, the droplets don't travel far. So that is the reason why we are saying maintain a distance, because this virus does not travel in air. It is only transmitted through cough or sneezing, or through if someone has it on the hand while coughing and sneezing. And so it's a person to person. So maintain a bit of a distance so that, if it was traveling through air, the whole world would have been infected by now. If you're seeing it is being infected by carriers getting it from other countries. And that is why you're also seeing that where there are international airports, you're getting more number of cases. Be it Mumbai, be it Delhi, be it Hyderabad, be it Bangalore, be it Chennai or Kerala, where a lot of Keralites are working in Middle East, Dubai, Iran, and places like that. It's only when these people go into the villages or rural areas, into their hometown, then they're carrying it forward. But the maximum cases are being seen in these cities. Our own counterparts, the Andhra region, where Telangana has more cases in multiples than the Andhra region, basically because there is no busy international airport in the Andhra region. So there are 4 or 5 cases, whereas here it is varying between 30 to 60. Because again, Hyderabad is a good busy hub. So what I'm trying to say is that the person transfers it. So be away from, treat every other person who's there as a person who's likely to have coronavirus, because everyone is not being tested. So keep a safe distance, thinking that this person may have a coronavirus. If you keep that safe distance, then you don't get it at all. Thank you so much.